The benefits, why we are see favorably to make hormone receptors and HER2/neu in our country, because these results of the literature that shows that the hormone therapy and the monoclonal antibody trastuzumab produces these results. So they clearly are in favor of the patients. So we think we cannot discharge these two exams in our basic pathology reports. This is the other problem, to have these results in a confident way. I mean, this analysis of 2,079 patients that compared fish with immunohistochemistry in a clinical that is the Fundación Santa Fe in Bogota, showed a false negative rate very high, a false positive rate very high, and this a high number of inadequate blocked tissues sent for fish. So we have a problem there. Also, there is a very inappropriate handling of the samples to do these studies. This is the distribution all around the country of our services of oncology and oncology pathologists. You see, we only have 4. All in the country. We only have oncology pathology service 7, and we have 9 cities with breast surgeons. We have till now around 30 breast surgeons all around the country that are in all these cities. Many of these cities send the samples to only 4 cities that have immunohistochemistry in our country, and all the samples are sent there to make the technique in these cities. And then we have a problem that many of those results, many of those slides are returned to their cities, and then the general pathologist is who read the slide, not the oncology pathologist. This is the other problem with the accessibility, the cost. This is what this test costs in our country. $25 for hormone receptor, each one. HER2/neu, $75, and fish, $435. This make that the cost of these 2 exams is very high for our population. If you see the cost, this is a very basic economic study we made, evaluating tamoxifen and trastuzumab. And you see that tamoxifen has an incremental cost relatively low, and averted costs bigger, and probably the use of tamoxifen in Colombia is very, very justified, is effective and at low cost. But in trastuzumab, the difference is very, very, very high. So this is one of the problems. What do you do if you do a HER2 exam and you cannot afford the treatment with trastuzumab? How much is that? To avoid a relapse, the cost is $600,000. And to avoid the death, $1,008,100. So it's a cost very, very high in a country with a a product per capita of almost $5,000. Our proposal for our country and for here for this meeting: standardize the sample processing regarding quality of tissue section, paraffin, and buffered formalin. Reading and interpretation by a specialist pathologist. Is it necessary for all the cases to make progesterone receptors? I don't know. And to reduce the cost of to new diagnosis. Thank you.
Thank you very much. So it's my pleasure to introduce the next speaker, Dr. Ann Rila from Axios International, who is going to talk to us about patient navigation as a tool for improving healthcare delivery and experience in Ethiopia. Dr. Rila is a medical anthropologist and has wide-ranging experience in developing countries in Africa, Asia, China, and the Middle East. In recent years, she's been focusing on initiatives to introduce and mainstream cancer prevention and treatment in developing countries. Dr. Rila.